Hi, my name is Dr. Karla Maguire. I'm an OB-GYN here at UT Health Austin, and I'm going to be answering some of the most searched questions about the postpartum period, which is often called the fourth trimester. How often should I follow up with my healthcare provider after giving birth? Well, the routine checkups after delivery are 2 weeks after delivery and then 6 weeks. Sometimes, depending on your situation, if there were complications with the delivery, such as high blood pressure or other issues, we would want to see you back sooner. So definitely check in with your doctor and see when they want to see you in your particular situation. What happens to my body after childbirth? So I think often in this country, celebrities go back to normal after having a baby almost immediately. And I like to tell my patients that it took you 9 months to create this baby. It's going to take you 9 months to get back to normal. So I think it's really important to give yourself some space and some time to kind of get your body back to feeling normal again. The uterus in pregnancy grows a lot, and it takes some time to get back to its normal size. Plus the muscles in your belly and in your pelvis all are stretched to accommodate the baby. So I think the most important thing is just realizing that not everyone can go back to normal immediately, and you made a human, and that's a really important job. What are ways to ease pain and discomfort after childbirth? The nurses on postpartum will start teaching you to take care of any pain that you have after delivery. A lot of women have cramping, which we do give medications for while you're in the hospital, which sometimes you continue after you go home. Other things like ice packs to sensitive areas can be helpful. If you've had a C-section, using kind of an abdominal binder, which is basically like a medical compression device on your belly, can be helpful. There are also other kind of local medications we can give you if you've had a tear. So definitely there are things we can do to help you be more comfortable. When can I begin exercising again? So depending on your type of delivery, your doctor will give you specific criteria on when you can start exercising. But if you've had a vaginal delivery, some people feel okay doing light exercise like walking and everything 2 weeks after the delivery, and we want you to stay active. Yoga is always great postpartum as well. If you've had a C-section, you can start walking as you feel comfortable. But no, I wouldn't do intense exercise with either type of delivery for at least 6 weeks until you've had your postpartum checkup. And of course, it's always important after delivery to listen to your body. And if your body is tired or telling you not to do a certain kind of exercise, to kind of listen and take the time you need to recover. When will the bleeding stop, and how much bleeding is too much? Every woman is very different, and again, it depends whether you've had a vaginal delivery or a C-section, but often the bleeding can go on until you come in for your 6-week checkup with your OB-GYN, but it should be getting lighter and lighter with time, and some women only have a couple weeks of bleeding, but some people will have more prolonged bleeding. The important thing with bleeding is that if it is very heavy, so if you're soaking through like 2 pads an hour for 2 hours, or you have clots, or you have an increased amount of bleeding after you previously had no bleeding, you definitely should reach out to your doctor to see if they need to examine you and make sure everything's okay. When will my normal menstrual period begin again? So that depends on a lot of factors. The first being whether or not you're breastfeeding, because some women who are exclusively breastfeeding won't get their period until they wean. So it could be up to a year until you get a normal period. However, some women who breastfeed do get a normal period starting pretty quickly after delivery. So usually the earliest it would be within 6 weeks or so. And the way I tell my patients is just to keep track of your bleeding, and if it seems to be coming monthly, then your period has started again. But it can be a little confusing in the first 6 weeks to figure out if you're having a period or if you're having normal postpartum bleeding. How long should I wait before having sex? So definitely you should go to your 6-week checkup with your OB-GYN, where usually we do an exam to make sure everything is healing well. Then after that, usually we let you know if it's okay to go back to having sexual activity. What should I do to prevent post-delivery infections? So if you did have a C-section, you're going to have an incision on your abdomen. The nurses in postpartum will talk to you about how specifically to keep it clean, but it's important to keep it clean and dry. So, after you shower, pat it dry, wear clothing that isn't too constrictive on the incision, and then keep an eye on it. And of course, if you see any any redness or any drainage from the incision, give your doctor a call and we'll be happy to see you sooner than your postpartum visit. If you had a vaginal delivery, we recommend that you keep the area clean and dry as well. We give you a little squirt bottle to clean after you go to the bathroom and to pat the area dry, and just to keep the area as clean and dry as possible. Luckily, it does heal very well most of the time, but if you have any concerns, of course, let us know. How common is postpartum depression? Studies have shown that postpartum depression can occur in up to 1 in 10 women. So it's really important to be on the lookout for any symptoms. The first 2 weeks after delivery, you're going through a humongous change. You're a new mom, you're adjusting to not sleeping much, you're breastfeeding, which can be new for people, and it's just a completely new experience. So often with all the hormone changes, you can have what we call the baby blues. And that's just feeling sad, crying for no reason, feeling a little tired and down the first 2 weeks. Definitely if it's something where you feel like hurting yourself or hurting the baby, you should definitely let us know. After 2 weeks, if those feelings persist, is when we start thinking about postpartum depression. And of course, reach out to your doctor if you're concerned about it. There is a depression screening tool we use in the office to see if you're at high risk or low risk for depression. And we can either help you get set up with counseling. Sometimes we start medication in the postpartum period, but it's really important to reach out to us because we don't want you feeling alone during this really important time in your life. Do I need any additional vaccines after giving birth? So during pregnancy, we recommend that you get your COVID vaccine and your flu vaccine and the Tdap vaccine. So if you haven't gotten those in pregnancy for any reason, it's important to talk to your doctor to see when you should get them postpartum. We also check some labs at your first prenatal visit to see if you're immune for rubella and varicella, which is chickenpox. If you're not immune, then we go ahead and usually give those vaccines postpartum. So definitely check with your doctor to see if you need additional vaccines postpartum. Well, today I answered many of the most commonly searched questions during the postpartum period. Every patient is unique, so if you have specific questions, please make sure to reach out to your doctor.